you sit at a computer every day and you have problems with your arm, your wrist, or whatever, a lot of pain through there, we probably have carpal tunnel syndrome. And you think that, well, I'll just take a pill. You don't need to take a pill. You need to get some relief from it from this young lady, Dr. Sonia Spencer. How are you?
Hey, I'm doing great.
Well, good. Now, you said that this is your favorite thing to treat.
It is.
Why?
Well, I just love helping people with their hands.
Mm-hmm.
As a chiropractor, I value my hands very much.
Oh, I bet.
My hands are my life. I love touching people. I love helping people with my hands. And if we don't have the use of our hands, we just lose so much of life.
Yes.
You think about how often we're using our hands all day long, every day. And
well, in today's digital world, I mean, usually you see everybody walking down the street going
yes.
with their phones or anything like that. So, yeah, you're right.
Yes, and we have to be quick with our hands.
Yes.
Yes, we have to be able to use our hands. We have to be able to open jars, open our mail,
hold our kids.
All of those things. And the use of the hands is so important. And so many people think that that this is something they have to live with or have surgery for. And I tell you, chiropractic helps because there's a little tunnel in here called the carpal tunnel,
mm-hmm.
and sometimes the wrists can get, the little bones in here can get stuck.
Right.
And we can adjust these wrists and free that up, and the nerves begin to flow again. A little thing you can do to look at yourself, especially if you're older. You see this little thing right here, Jim?
Mm-hmm. Yeah, right in here.
I call this the chicken leg. See if you can make yours a chicken leg. Yeah. So you see how nice and meaty your chicken leg is here?
I don't know if I like that term meaty. That means, yes, I see. I have a meaty chicken leg.
Yeah, you have a meaty chicken leg. But on some people who've had carpal tunnel so long, they lose the muscle here.
Really?
Yes, because the nerve is not working. That's going to that muscle now. And so they can lose the muscle on either side. And this is an indication that they've had the problem a long, long time. Okay? And it's almost like sunk in. So when we examine a patient, we do a lot of things to them, really to see if they have restrictions at the beginning of the nerve, which starts in the neck,
mm-hmm.
and then we go all the way down to see if they have problems here, and then we clear up any interference along the way from start to finish.
Mm-hmm.
So let me talk to you about where the carpal tunnel nerve starts and where it ends, because that's really important.
Okay.
Everything starts in the neck mm-hmm. with the carpal tunnel. You have the nerves that come out of the lower part of the neck,
right.
or the cervical spine,
mm-hmm.
if you want to get technical, and form what's called the brachial plexus. And through the brachial plexus, that comes out and goes down around the shoulder, and part of it goes on the left side of the hand, and part of it's going to go on the right side of the hand. And these nerves come through here and form, go through this particular area called the carpal tunnel. So anyway, we're checking for entrapments in the neck, in the shoulder, around the elbow, and down into the carpal tunnel.
So it may not be just a problem right here.
It may not be. It may not be. A lot of times, especially in people who are looking down and typing a lot, their muscles through here are very, very tight. They start squeezing this nerve. That can cause arm pain all the way down, including in the whole hand.
Right.
So it's very common for us to see patients who have arm pain all the way down, or shoulder pain all the way down, in addition to very tight muscles here. So we want to clear up what we call the entrapment mm-hmm. anywhere along the area that it can be happening, and help a person function better. So it starts with an examination of the neck. We look to check to see if all of their joints in their neck are gliding properly or in their proper position and
right.
alignment. If they're causing any pressure on that nerve, or if they have any swelling in there, or if they have over tight muscles there, we start treating that area very, very gently. If the muscles are over tight in the shoulder, we take care of that. We show them how to do posture exercises and so forth. And then we could just continue on down from there, looking at the elbow, and then finally, looking at the wrist. checking, feeling, making sure those bones are moving well, doing that chicken leg thing I told you. Checking a person's grip strength.
I bet you're out there doing it right now too, aren't you? You're out there checking your hands, saying, "Oh, I got the chicken leg thing going on there."
Yes, and we check their grip strength to see how many pounds of pressure they can pull,
Yes.
left side and right side. Some people are very surprised at how weak they've gotten. And we do other muscle tests on them as well to see if other areas of their body could be involved, other muscles involved, and so forth. So again, we're kind of like a detective here, trying to figure out really what's going on with this patient and all the things that we can do to help them, not just today feel better but to prevent further injuries in the future with the way that they're doing things in their life, educating them on how that they can take better care of themselves so that they don't repeat the process when they're no longer our patient.
Well, one of the things that we've talked about so many different times is that it all starts up in here. It seems because there's so much of your nerves that from the brain that just comes down through here, and it goes through your entire body.
It does.
I mean, we've talked in the past about your lower back, the neck pain, and your head migraines and headaches, and it all seems to start from right here. And you can probably, by treating this, keep a problem from happening elsewhere at a later time.
Right.
And people may not think about that.
Right. Your spine is and your nervous system is so important. And having your spine checked to make sure that everything's moving and in its proper alignment can prevent degeneration or arthritis of your spine. So the more free that you're keeping your nerve system now in your life, the better your quality of life is as you age. Because one thing is for sure, Jim, we're all going to get older, and the better that we've taken care of ourselves now, the more quality of life we're going to have as we age. And I don't know about you, but I want to feel good when I get there. I don't want to be saying, like I hear so many times, I wish I would have taken better care of myself. I wish I would have done more prevention in my life. Now that I'm retired, I don't feel good.
Right.
I hear that so many times from people who really have not taken good care of themselves over their life. One of the things I love about us in our office here is that we help people with their quality of life and teach them a better way.
That's right. And quit trying to mask it with pills. You don't want to do that. Dr. Sonia Spencer, thank you so much again.
Thank you.
If you'd like some more information, call the number on your screen. Set up an appointment with her. She's located on Pass Road in Gulfport, right across from Pass Road Elementary, which is just west of Hardy Court. You're having some problems with the carpal tunnel? Give them a call here at Sonia Spencer's office.